To prevent medication errors, keep in mind the 6 rights of medication administration each time you prepare to administer a drug. Right medication, right dose, right patient, right route, right time, and right documentation. Let's take a quick look at each, beginning with the right medication. Review the Medication Administration Record, or MAR, to make sure it is clear and complete. The order must include the patient's full name, the drug ordered, the dosage and route of administration, and the time of administration. With prepackaged unit dose medications, check the label against the MAR when you take the medication out of the dispensing system. Then check the label against the MAR as you place it in the medicine cup, and check it again at the patient's bedside. If the medication requires preparation and is not in its original container, be sure to label it. Include the name of the drug, its strength, the amount, and the expiration date or time. If you must prepare a dose from a larger volume or strength, or if the prescriber orders the medication in a system of measurement that's different from what the pharmacy supplies, calculate the dose or make the conversion carefully.
Hey, Jessica, can you verify this calculation, please?
Sure.
Ask another nurse to do the same calculation independently, and compare your results to confirm that you've calculated the dose correctly.
That's what I have, thank you.
You're welcome.
When you administer insulin, a narcotic, a sedative, or an anticoagulant, follow current guidelines for administering high-alert medications. And remember these other important safety guidelines to make sure you give the right dose. For a liquid medication, use a standard measuring device, such as a syringe or a graduated medication cup. Ask the pharmacy to split tablets for you, or use a cutting device and only split tablets that are scored. Discard any pill that doesn't break evenly. If you need to crush a tablet, mix it with a small amount of food or liquid to make it easier to swallow. Never crush sublingual, enteric-coated, or extended-release tablets. Always ensure you have the right patient by using 2 identifiers. For example, check his ID band, compare it with the MAR, and ask the patient to state his full name and birth date. Do not use the patient's room number for identification. The right route should be specified in the medication order. If the route is missing from the order, or if it's not the recommended route for the medication, consult the prescriber immediately. For an injection, be sure to use only a preparation intended for parenteral use. Injection of an oral medication can be life-threatening. Parenteral medications must be labeled for injectable use only. To observe the right time, follow your agency's recommended schedule for routine medications. In general, give non-time critical medications within 1 to 2 hours of the scheduled time. For time-critical medications, stat doses must be given immediately, and now doses must be administered within 60 minutes of receiving the order. Use your clinical judgment about the timing of other doses. For example, if a drug must be given with food, administer it within 30 minutes after a meal. Always observe the right documentation. Document any patient pre-assessments you performed by recording your entry as soon as possible after giving the drug, as shown in the video skill Documenting Medication Administration. As part of your follow-up care, document the patient's response to PRN medications. Teach the patient about his medication, and remain vigilant to avoid medication errors. To learn about your rights and responsibilities as a nurse, see the video skill Preventing Medication Errors.